now open. Sorry ha, marinaset ang mga ayam. So, can you see it? So, this is the summary. Average time, 23 minutes of the 30 minutes. The lowest score is 18. Highest. So, average score is 43%. So, I think we need. So, let's go through. Mabilis lang. So, the first 43%. Got it 50% rather for the first question. For the amino acids, so 47 answered it correctly. The answer is serine. Which among the following does not belong to this group? And then about the action of antibacterial, so lactoferrin is the answer. Includes immunomodulation. Each of the following is a feeding or oral sensory motor skill gained at 12 to 18 months old. So let's see your answers. Okay, 57%. So it's holding and tipping battle. So we are integrating also your growth and development. Huh? So one did not answer. Why? Huh? So make sure that you answer. So might be the correct yes. Food security exists and all people have access. So what are the four main dimensions? Which one refers to being food secure at all times? So that's stability. For some, so what is the exception? So some. Okay. Which means all are correct. Huh? So anyway, somebody will report, but we got some you do actually edema testing, so it should be in both feet, not just one. So and then of course the weight for length or weight for height is below -3. And then there's also the MUAC. Then about refeeding syndrome, it occurs if there's high energy feeding started too soon. And so the answer here is, so clinical sign, hypophosphatemia, so that the person refeeding, so areflexic paralysis. Not true. So it's letter A because it should be 24 to 48 hours. The answer should be 24 to 48 hours. But what is being asked here is what is not true. So which means that you have to analyze also what is being asked. Which is the more accurate measurement of response to nutritional intervention among 6 years? So the answer is the hand grip strength. Which of the following is one of the most common mechanism for illness-related causes of insufficient growth? So all of that. are peptides synthesized in the lateral hypothalamus that can increase feeding, arousal, sympathetic activity. So the answer is orexin. So for number 12, you've heard about the traffic light, huh? Of course, it's traffic light, so there's stop, go, and in moderation. So which of the following is an effect of vitamin A? Excess, remember? Excess, not deficiency. So for vitamins, if there is hypovitaminosis, there is also hyperavitaminosis, and the manifestations are also not good. So that's why everything should be in moderation. Okay, so number 14. So the answer is slow growth. It's also an slow growth is an effect of vitamin A excess. So the other way around. So vitamin A deficiency is characterized instead by retarded growth. About for thiamine deficiency, the classic, you have your classic clinical triad. So the answer here is letter C, Wernicke and Seth. And then, which of the following is a dietary source? So, milk, cereals, and vegetables. Riboflavin is also found in milk products and also in eggs. Not true of niacin deficiency except niacin. The answer is B, because deficiency of this vitamin causes burning feet syndrome. So you have your pantothenic acid or vitamin B5. It's a component actually of a coenzyme A and acyl carrier protein involved in fatty acid metabolism. Okay, if pyridoxine is lacking, glycine metabolism can lead to oxaluria, and major excretory product in the urine is what? So the answer here is D, your 4-pyridoxic acid. So A, B, and C are all closely related compounds of your vitamin B6. Actually. Number 20, which among the recommended treatment for folate deficiency is incorrect? A is correct, B is correct. So C, high dose IM folinic acid may help in refractory cases only. High dose IV fatty acid for refractory cases, while IMFA for hereditary folate. Regarding clinical manifestations of cobalamin deficiency, the answer here, true except letter A. Involuntary movements are predominantly actually coarse tremors, not fine tremors. So that's what makes it wrong. So the rest are correct. Humans depend on dietary sources for vitamin C, which of the following is an inadequate intake for the age specified. So the answer is 14 to 18 years old. Really for adolescents, so 65 to 75 milligrams is needed for adolescents. About the typical features of vitamin C deficiency, so the answer is rachitic rosary. Scorbutic rosary is seen in vitamin C deficiency, and its annulation is usually sharper than your rachitic rosary. The radiographic appearance of long bones in vitamin C deficient children shows linear break in bone. The answer here is your tremor field zone, also known as zone of refraction, found in proximal and parallel to the white line of puncture. It's actually page 374 of your Nelson's. Number 25, the white line of Frankel, the zone of well calcified cartilage. What about Harrison group? So this occurs in vitamin D deficiency. Deficient due to pulling out the softened ribs by the diaphragm during inspiration. So, review lang kita na. So this most common genetic disorder causing rickets will be further explained for those assigned. It will be, you have to read. So that's X-linked dominant. So rare autosomal recessive disorder due to mutations in the genes. Share of isolated vitamin D deficiency is the answer here. So it's on page 385 of your Nelson's. Which of the following is incorrect? So A is correct, B is correct. So the answer here is letter C. Huh? Because for neonates, the dose is actually 25 to 50 units per day for 1 week. And children with deficiency as a result of malabsorption should receive 1 unit per kilogram per day. For this form of vitamin K deficiency, so it's late VDKB is the answer, because early is formerly called classic hemorrhagic disease of the newborn, which occurs at 1 to 14 days of age. The low stores of vitamin K at birth. This one is already 2 to 12 weeks, so that means late. Laboratory findings in vitamin K deficiency. So normal PTT in early deficiency, but PTT is usually prolonged. So pro time is prolonged, but can be normal when there is mild vitamin K deficiency, and platelet count and fibrinogen levels are also normal. The deficiency of this micronutrient causes impaired glucose tolerance, peripheral neuropathy, and NSF. So the answer here will be your chromium. It potentiates the action of your insulin, and its deficiency causes the effects that are listed here in this question. What is Christian disease? So it is caused by selenium, and dietary selenium deficiency is associated with cardiomyopathy, which is your Christian disease, otherwise called as your Christian disease. Okay. You're able to answer? Enzyme involved in its digestion. Huh? So for amylase, breaks starch down into simple sugars. Diba? And then disaccharides digest disaccharides of its lactose and maltose are 2. So phosphorylase is an intracellular enzyme. So there's no correct answer. In your exam, sugat ba hinit ka butang or what?
Yes po, same lang po.
Sugat. So paano niyo na may ano?
May choices.
May
po,
choices.
Doc.
Okay.
Yes po.
Okay. So this one, so again, as I've said, this is your review of biochem. Huh? So the answer, sige, i-review na lang. So, biri-biri is what? these deficiency diseases are rarely seen. Oh, I mean, in developing countries, it's like the Philippines, it's very common. So vitamin A, anyway, kahit pagkakuan. So may choices, ha? So you have to know what's causing it. So anyway, just to tickle your mind. So maybe you look for the answers if you're not able to. And so I'm not going to tell you. So select also the appropriate vitamins. So these are the things which you have to know. Different kasi kung din he said I will just inform you, you will just compare it and you will look for the answers. Okay. So I just would like you to okay. So given so the answer here is supplementary vitamin D is necessary in infants who are given evaporated milk. So with those who are breastfed and even commercial formulas or those like for example in the Philippines, our babies need not be given supplemental vitamin D. Remen kita winter din here. So that is the review. So let's now proceed to so in just 1 hour, you have to summarize what you are supposed to know, but it doesn't mean that you will not read. Just any questions so far? Mabilis lang.
Wala'y nagsabi sa
While, huh? Nutritional requirements. So I know somebody will report on this, but just to start. Because you have to know the nutritional requirements before we can give our okay. Okay, naglo-low. So you know what is growth and what is development, and you know that growth is very rapid, especially during the first most important is actually the first 5 years of life, and especially for stunting. So the first 3 years of life predict adult stature and some health outcomes. So if there's stunting, so there, that's why we have the program, the first 1,000 days, diba? From conception up to 2 years old. So it's very critical because after 2 years old, once we these children are stunted, even the cognitive can be irreversible. So the first 2 years especially is very important. So, and it's not just after delivery, but even before their birth, from conception. So it's very important. And we know that malnutrition is very common here in the Philippines and actually worldwide, based on WHO report, but it's especially here in our country, it's still common. So that's why we have the PMAM, so a program, the Philippine Integrated Management for Malnutrition. So the problem is not always communicable, meaning infectious, like for example, what we are having now, the pandemic. So non-infectious also problems also are very important, especially in terms of nutrition. So we have your dietary reference intake, which provides guidance on nutrient needs for individuals and groups. And of course, so you know your year, and you also have to know what is the recommended dietary allowance and then the tolerable upper limit. So we actually cannot derive or cannot be calculated. So there should be an adequate intake, so to develop these guidelines. So this is the normal requirement distribution of hypothetical nutrient showing percentile, the recommended daily allowance. So we have now we use now the z-score rather than the percentile. So of course, there is an imbalance, so under and over. So malnutrition is not only it's not only undernutrition, but there's also a problem for overnutrition or obesity. So, energy requirement. So you have your this is just to introduce to you. So and you have to read more. So you have your BMR, you have your thermal effect of food, energy for physical activity. So thermal effect, so at the energy required for digestion and absorption. Actually, like for example, for your protein, more energy is required to digest protein. Okay, so and when we discuss about nutrition, it doesn't mean that it only pertains to food. Activity or exercise is part. In fact, even dental care is also part of nutritional guidelines. So it's not just purely the food intake. So activity also, or exercise, and also the behavioral. So the timing when they will take food, and also the nutritional. So of course, you know, you have your macronutrients, so the protein, fat, carbohydrates, and your micronutrients. And so these are the acceptable distribution ranges. So depending on the age. So in pediatric, so you have to take note that you always have to take note of the age group. So that's why even for the history taking, so different, diba? For neonate, for older children, different also for adolescent. likewise, the same thing with the requirement. So it would depend on the age. So fat, so it provides 9 kilocalories. More important should be better if it comes from not from animals, rather better if it comes from vegetable oils. So your soluble vitamins are needed for it to be digested. So you have your trans fats, your saturated fats, and unsaturated fats. So actually, we try to avoid this. So remember, training starts when they are young because it becomes a habit. So the animals fat, especially because it can increase the risk for cardiovascular disease and metabolic syndrome. So between and we request we highly recommend the unsaturated fats, like your corn oil, as I've said, coming from animal sources of plant sources rather, and fruits, rather than your saturated fats and your trans fats. Especially trans fats, it's the one being used for your when they cook your French fries. So that's why it's not advisable. Okay, so you know your good cholesterol and bad cholesterol, diba? Your HDL is your good cholesterol, and your bad cholesterol is LDL. So again, type of fat intake, the sources of fat intake. Okay. So you have your essential fatty acids, your ALA. So and DHA, you always see, you always hear this from, especially talking about commercial milk. But still, remember that breast milk is the best. Complete siya. So although ito yung mga inaano dito, mga commercial milk na there's DHA and all, because it actually has also a good effect. But then still all of us should be breastfeeding advocates or breast. About the protein, so of course it provides 4 kilocalories. So structural and functional roles. So meat, poultry, eggs. So again, if there's increased intake, so there's a problem, and limited intake, it can cause also problems. So that's why we have to follow the recommended allowance, dietary requirement. So you have your this is a review from your biochemistry. You have your indispensable amino acids, your dispensable, and of course conditionally indispensable, and meaning conditionally indispensable. Those are requiring a dietary source. The endogenous synthesis cannot meet metabolic need. Indispensable, humans depend on dietary sources to meet adequacy and prevent deficiency. So this is needed in the diet. Again, breast milk, considered the optimal protein source for infants. So even for more than 2 years old already, so that's why we say we have to breastfeed, exclusively breastfeed for the first 6 months. Then even if we start solid food or complementary food, we have to continue breastfeeding up to 2 years and beyond, because even if there's minimal amount of milk, breast milk that the baby will suck more than 2 years old, but still the protein and the fat are still the best sources. So we continue giving it. And of course, your carbohydrates, it also gives your 4 kilocalories. So remember that your monosaccharides, the simple sugars, and your disaccharides. So you have your maltose composed of your 2-glucose, sucrose, glucose plus fructose, and your lactose. Actually, the carbohydrates is best if we in application to clinical, it's better if we actually take in complex carbohydrates rather than the simple sugars. So especially for those who are in the extreme, so the overweight, obese. So part of the recommendation is for them to take in, especially even for diabetic, to take in complex carbohydrates rather than simple carbohydrates. Mas magutom, mabilis magutom kung simple carbohydrates kaya mas madali hiya digest. So chronic low carbohydrate. So what will happen? So what will be the pathology? So you have to notice the excess and the low intake. So what will happen? So as I've said, everything should be in moderation. Okay, there will be problems that we will be encountering. I just would like to emphasize this. That's why what is being advised now is for children, we give them, or even for us, that we eat fruits rather than fruit juices. And then because excessive intake of juices coming from, even if it's coming from fruits, and then of course, especially if sugar is added, much more if it's commercial. So what will happen is can also cause abdominal pain. There will, kung may lactose intolerance, there's actually also what we call as fructose intolerance. So kaya very common in children to have and so you always have to check on the intake, the food intake. So kung sobrahin gatas, even if more than remember, up to 6 months milk is a complete food, but starting 6 months the solid food should already be started, because that cause problem, like there will be intolerance also. So you've heard about your glycemic index. So it's a natural peak blood glucose 2 hours after ingestion of given food compared with a reference standard, which is actually your white bread. So your white bread is actually simple carbohydrates as compared to your wheat bread or your corn bread. So lower glycemic index foods are recommended and may reduce the risk of insulin resistance and your cardiovascular diseases. So and what are these? So these are the complex carbohydrates of lower glycemic index. So the fiber is very important. So that's another reason why we actually advise to give children fruits rather than juices, because especially the commercial juices, they're actually just flavoring plus sugar. So even if they say that it's coming from the fruit, so actually the fiber is lost. Okay. Benefits of fibers. So of course, it prevents constipation. Very most next to, so what are commonly referred to me. So usually not only cases of diarrhea and jaundice, but lately I've been receiving a lot of patients with constipation. So, and it's actually part of that is because of the diet. So especially if more milk, rather than solids. And even if they are given solids, so the quality of food, so there's less fiber, so they have problems, and it becomes a chronic problem. Okay. So of course, you have your micronutrients. So you've heard about food fortification, diba? So like your iodized salt, it's actually a strategy to prevent some nutrient deficiency. Again, breast milk is very important because it's actually a complete food, although iron is given even if they are breastfed, especially by 4 to 6 months, because the body reserve coming from the mother is also decreased or being depleted. So infants and childhood, and then those who are menstruating already, so adolescent, they need more iron. So the most common micronutrition deficiency in the world is actually iron, then zinc deficiency. So this is also associated with increased risk for linear growth or stunting. So that if you have relatives who would like you to give them vitamins, actually when do we have to prescribe vitamins? Actually, if they can get from their food intake coming from fruits and vegetables, so those are natural sources. We don't have actually to give multivitamins except when they are sick. That's when we are supposed to give them. And of course, if clinically we see there are deficiencies. So pero kung may they are asking kung pampatangkad, so actually you have to give them you have to give them vitamins and minerals, especially zinc. So vitamin D, so we don't have a problem here in the tropics, so like the Philippines, because we get it from Saripa, libre, from sunlight. There are actually like indications only wherein we have to give vitamin D, more especially for patients who have problem like jaundice patients, cholestatic jaundice, so they need fat-soluble vitamins, your attic, because especially if there's obstruction, bile is needed for it to be absorbed, and more often than not, since there's obstruction, so we need to give them fat-soluble vitamins. That would include your vitamin D. Calcium is very important also. So we have what we call calcium banking. So up to the age of 29 years old only. So after the age of 29, so kumbaga, dili na kita ka-deposit. We get from what was an aton gin deposit to. Of course, we don't get from what we deposit if continuously we give calcium. Otherwise, so that's the reason why children, and even for us, for you, not yet 29 years old, make sure that you have your calcium deposit as early as now. After that, especially in female, because they also lose calcium. That's why females are more vulnerable to have osteoporosis. And vitamin A is part of addict. It's an important cofactor for coagulation factors. So for those lacking may lead to bleeding. And of course, you have your electrolytes, your potassium and sodium. So again, this discussed more, and you can read more on this. So even electrolytes, if it's increased or decreased, it can also cause problems. So again, everything should be in moderation. And water is very important. So proportionate to the body weight, and they are highest in infants, and of course decrease with age. But for the first 6 months, breast milk can actually provide the water, even the water requirements. So we don't have to give even water. So exclusive breastfeeding. So we don't have to give water for breastfed infants. So they get it from breast milk. So we start giving water when we start giving complementary food. Okay, so this is what we have to it's not percentile lang, we are using already z-score. So that's why part of your is to download your growth charts, download the z-scores, not the percentile, although that's equivalent if we say under, so that means below. Z-score below -3. So kung obese, above 95th or above +3. So this is if we use the Z-score. Okay, so we have the classification. Okay, what's the time now? So we still have 30 minutes. Sige. Can I see any questions from the chat box if you have any concerns? Maybe it's just for the exam.
Kapag
Okay, we discussed this. So this is what I want to show. You have to know how to interpret. If you measure the growth, you have to plot. It's different if you don't. You have to differentiate between familial short stature and your constitutional delay. So of course, for constitutional delay, so the child is shorter than average for most of her life, but later on, nagiging normal hira, nagka-cuts off hira. And then your familial short stature, so inherited here. So you also have to, when you do your assessment, you also have to take into consideration the height also of the parents. So there was a study done between breastfed and formula fed. So because this is commonly asked, nga pag mas dako kitaon and mga breast and mga bottle and formula fed infants than breastfed. So kasi it's more fat tira as compared to breastfed nga lean. So for breastfed infants, they would look like they are not that big. But if you weigh them, kay lean man hira, so they're actually the weight is also is even better than those formula fed. So that's why we still have to really be more, in terms of breastfeeding. So this is the Z-score. So this is what we use now. So the normal is percentile 0, or that's equivalent to Z-score 0. And then of course below -3, severe, between 2 and 3, that would be moderate. As compared the diliwatan +3, so above +3 would be the obese. Between 2 to 3 would be the overweight. So you have to take note of that. So of course, so we have to plot. So this is the comparison between your Z-score and your equivalent percentile. But as I said, we are now using the Z-score instead of the percentile. So your normal would be your normal would be your 0, 0 to 2, 0 to -2. Between 2 to 3, so that's overweight. Above 3 is obese. So likewise, going down between 2 to 3 is moderate malnutrition. Below -3 is severe malnutrition. Okay. So 0 to 6 months, what's needed would be only one kind of food. So that's your breast milk. So anyway, you'll have more. I hope you discuss about breastfeeding more. So that's why with the EINC, we do not separate the mother from birth. So we have what we call skin-to-skin contact. So you don't separate them. So para within 20 minutes to 1 hour, the baby is ready to feed. So the baby is with the mother. So very important would be to non-separation of the baby from the mother. So you know the benefits of breastfeeding. It's not only for the baby, but also for the mother and also for the environment as a whole. So there will be no cons anymore. So we help Mother Earth. So when is feeding with breast milk substitutes indicated? So of course, there are actually you have to infant condition and maternal condition, but the only reason, or the only reason that we cannot give breast milk to an infant if the infant has galactosemia. That's the only and medical indication. So even if MSUD, there's a special formula, but we can still actually give a little amount of breast milk. But for galactosemia, so it's an absolute contraindication. So you have to know. So again, some maternal conditions, those patients or mothers with HIV that cannot, but if we can replace them with AFAS, meaning acceptable, feasible, affordable, sustainable, safe, then we cannot give breast milk. But if may demand, if there's not available, then we can continue to give breast milk even for patients with HIV. Of course, severe illness in the mother, but these are only temporary. So, for example, those with receiving radioactive iodine, so they can resume breastfeeding about 2 months after receiving this substance. Or cytotoxic chemotherapy, so during therapy, but after, yes. But patients, breastfeeding mom, can they be given vaccine like for COVID? The answer is still yes. So temporary lang, those with breast milk abscess. So anyway, no these indications. And how to, if ever you need to, so actually within 1 hour, within 1 hour after for commercially prepared, then you have to discard already. 1 hour after in prepare. So even if you put them inside the ref, remember milk is a good medium for bacterial contamination. And for complementary feeding, so it should be timely. When is it? So 6 months. So appropriate, so adequate, safe, and should be properly fed. So in feeding, it's not only the nutritional aspect, it's also there's also the social aspect. So and again, the training starts when they are young. So ideally, there's the baby that should be eat with their family, young as they are, because there's also the social aspect. And it's not in training children, it's not just telling them, it's actually show and tell. So even for it's show and tell. Responsive feeding. So remember one thing, the satiety center in the brain closes after 15 to 20 minutes. So that's the reason why there should be no distraction, because no matter how, even if buti talaan na kaon, if it's already more than 15 to 20 minutes, so that it will shut up. So that's why no distraction. Feeding time should be feeding time anyway. So these are guiding principles. So well-balanced meals for older children. So we actually they use kung sa my plate, but we have the Filipino version, the pinggang Pinoy, So but it's still 1/4 fruits, 1/4 vegetables. So meaning it's fruits and vegetables is 1/2 of the plate, and then of course the carbohydrates is 1/4, and then protein is so this is pinggang Pinoy. So we have this, and then of course we have the food guide pyramid also to guide. Remember, exercise is also part. It's not just the food, so activity is also part. So for an optimum growth, so high balanced meals and snacks, and of course positive eating environment. That means you'll have a well-nourished child. Okay, this one I would like to emphasize this. because although there are new figures now, but I want to emphasize for this the type of so pag malnourished lang talaga affected, huh? So there is reductive adaptation. So there's decreased to utilize of the minimum amount na decrease ito na function. Ito na tanan in malnourished children. Huh? So even the villi, look at that. Huh? So it's also flattened. So that's why for malnourished children, they are also commonly they have diarrhea, and so it becomes a vicious cycle. Vena, so all organ systems are actually so there are actually two types of the nutrients, your type 1 nutrients and then your type 2 nutrients. So the type 1 nutrients, so these are the what's under, and these are the nutrients wherein we can see as very early the signs and symptoms. For example, iron deficiency, so there's anemia, the vitamin B complex deficiency, you can see but the growth is not affected, meaning the height is not affected as compared with your type 2 nutrients. For your type 2 nutrients, like zinc is under here, so growth is actually affected. These are the differences between your type 1 and your type 2. So again, so that's why type 2 is considered as your growth nutrients, while your type 1 functional. So there are signs of deficiency, and then but stunting with deficiency is absent as compared here. I want to emphasize for this slides. So for breastfeeding, so even no matter if problematic it's on mother, like for example on baby, so you can still actually have it's just the positioning, the position, like for example this baby with cleft lip and cleft palate. So for cleft lip and palate, actually there can be there's a special nipple that can be used, but actually depending on the severity, so kung masasarahiya just by without using this, so we've seen patients na kaya naman. Of course, very important the lactation support, or there should be a team which would support the mother, especially for first time mothers. We really have to have, that's why in the hospital it's a requirement that all employees, not only those in the assigned at the NICU, should know about how to counsel regarding breastfeeding, lactation support. So the more for you, even if you are medicals, the more for you kay medical students ka mo, you have to know how to. So again, exclusive. Now for picky eating, actually for picky eater, so it's also a common problem, di ba? Kasi application na natin ini, there are more frequent struggles. So, but studies also have shown that it matters even from the during pregnancy, So if the mother eats a variety of food, so it can be actually they can remember that. So that's why another advantage of breastfeeding is that depending on what the mother will eat. So nag-iiba-iba itong nag-iiba-iba itong taste, ha? As compared to the cow's milk nga, monotonous itong kuan, ha? But for breast milk, it depends on what the mother will eat. At the same time, they will remember it, ha? The baby, the baby, so may dito study nga naginhimo. The baby can remember kung anong na taste while she was still inside. So as they grow older, so somehow they can remember it also. But another thing, so before mag 1 year old, itong baby should already have eaten all types of food before mag 1 year old. Kasi kung more than 1 year old na, saka pa kita mag-start, so the more that they will have problems with picky eating. Huh? So that's less than here what's being said, 4 to 5 years old limit the sweets, huh? But in my practice, so less than 2 years old, so I always tell that the family not to give them anything sweet, so it should come from fruits only. And true enough, as they grow older, kay diri man hirasanay, so it matters. So what we give, so we have parents, or including it, titos, titas, and grandparents, especially for us Filipinos, inin kay extended family kita. So everybody should follow unta, nga children should not be given mga magtamis except coming from fruits, kay para so we have something to do with it, hinuman it napalit, hinuman it nahatag. So again, training should start when they are young. Okay, so you can laboratory as usual, and when you do your diagnosis, it's we always start from history, from physical examination. By the way, another important thing that we have to remember is from 1 to 5 years old. So somehow the expected gain in weight and height is not as fast anymore as for those for the less than 1 year old and more than 5 or 6 years old. So that's why during this stage, the parents will notice that there is a decreased appetite. So, but that's the reason why it's important for us to plot the anthropometric measurements, because it's not just the appetite that we have to take into consideration, the growth, and of course the development also. So this during this time, so there is what we call physiologic loss of appetite. They are no longer in a period of rapid growth. So the expected gain in weight and height is not that rapid anymore. So that the intake would also decrease. Another thing is you will hear that parents will say nga diri na ayon. So you have to emphasize to them that they need learning stage pero even with the taste, so they should have continuously be exposed. Sometimes it takes 7 to 10 times exposure before they will learn to like the taste of that certain food. So it doesn't mean nga parang ginluluwa that di rin hira na ayon. So those are important mga tips in terms of feeding these children. So 5 to 10 exposures. So for 10 years old. Okay. So what is food chaining? So kung mga kay makuligod pagpakaon, especially toddlers. So I'm emphasizing this, the basic. So please read, and then this one would be application. So for example, if you think that they like French fries, so you can use pero pareho gihapon. So instead of French fries, instead of using potato. So you can also use yun. Pwede mo himuon nga baga hash brown, or you can actually, what we recommend is healthy kamote, huh? So you can use that instead of the usual patatas, huh? So puro pareho iton kaluto. So we are really emphasizing breastfeeding, huh? So as I've said earlier, we do not force feed also, huh? So iton we have it's the child who regulates iton how much iton iyang gin kakaon. So that's the reason why we are not supposed to prepare so much, ha? Mas madali na ang pag add na lang, ha? Rather than they know nga if they cannot consume, uubuson nimo. So again, it becomes a bad habit, ha? So or 2 hours na kay gusto ipaubos. So again, it's not a good practice, ha? Because remember, so what will happen is they will not feel that eating or meal times is a happy event. So importante happy event for them, huh? So separate mealtime from playtime. So even gadgets, huh? Another thing for gadgets, so less than 2 years old, no gadgets at all. So back to ano kita dapat, ha? So stimulation. So either din istorya or educational toys, music, but we try to avoid gadgets. For 2 to 5 years old, it's actually 1 hour a day. But especially even for more than 5 years old, so there should be no television, haiyu dining hall, huh? So limit amount of milk and juice. So instead give fruits, huh? Okay. Again, as I was saying, parents determine what, where, and when, but the child determines how much, huh? How much she will eat, what she will eat. So another recommendation is there you can give choices, but remember whatever they choose, healthy hiya, huh? So diri ka ma-choosing ano sa healthy food and sa kuan ini junk food, huh? So but still it's also part of the training that they are given the chance to choose. And give 45, ha? So, especially kung i-eater talaga nga kuan init para ma-increase life calories, gurugutin ira na kakaon, pero somehow that food has higher calories. So, ang ito nga, for these children, we can fortify actually their food. Ha? So, with butter or vegetable oil, hindi po kaya o hindi 45. Ha? So, powder carbohydrates for food. And of course, schedule. There should be regular meal times. Huh? So again, not longer than 30 minutes, so 15 to 20 minutes. Kasi yun. And then the water should be given after eating. Huh? Not every after subo. Huh? Because it will give them tapos na ako kay ininom na ako. At another thing, pati pag clean itong iya mouth, it should be done after na, not every after subo, ha? Even kung may dadida na so again, it will give them tapos na iya. So sit under chair to catch mess. So expect na messy talaga ito ya, because there are some as they grow older kasi papatry na niyo pagkakukit kutsara. So, mag-expect na may dati messy. So, one para diri ka kurian, so shit under chair to catch the mess, ha? You don't give food as a reward, ha? So, even for example, for our patients na nagko-constipate, so we have what we call a diary. We make a diary, and then we have what we call star awards, if only to monitor kung na sit hira ha toilet at tapos that they try to move their bowels. So may na kami to sinising na behavioral rewards or star awards. But the recommendation is we don't give food as a reward or present. It may be an extra time, an extra bedtime story, or an educational toy, books, especially books, anecdotal, coming from my patient. So those who are really, very, exposed to books, and then reading before sleeping. So now these parents don't have, they say they don't have problems in terms of letting their children read. Iranat na kuan kay mahilig talaga yung libro. So again, training starts when they are young. So it's the same thing with giving the food. So small portion, solid first, so fluid last. We don't give, again, water should not be given in between. And then as they grow older, self-feeding is encouraged as much as possible. So kung nagmiminulay, so you can remove the food 10 to 15 minutes because the satiety center will actually close already. So wiping child's mouth, of course, after. So these are picky eating. So again, if para dili hira mabusog na. So another thing that we have to tell them is mga 1 hour prior to meal times like breakfast, lunch, and then milk should not be given to them anymore. Otherwise, pag tagan mo ng milk na busog na hira, the more nga dili hira kuan kaon. So you know how to compute for your BMI. This one, kung kiki-eater yan at out ng problem naman itong over, or overweight and over. So based on the BMI, there are cut-off points. Actually, there's cut-off points for WHO, but lately there's a separate cut-off points that's actually what we use for Asian. So we are part of Asian continent. So we use the cut-off point for Asian. So the BMI 18, although it's still 18 to 23, it's normal. Pag more than 23 to, it's already overweight. 23 to 25. So unlike here na 25 ako pa itong overweight. So lesser. So it's more than 23 for Asian considered already as overweight for Asians. Again, it's diet plus physical activity. So the balance. Increasing na gihapon, and then so what are the determinants? So they are saying that depending on the kadamuhit mga fast food. So especially during this pandemic, diba? I've seen a lot of cases of obesity and overweight in my patients, including the family. Kasi less pa ng activity, kaya diba na kadaman na kita kabalay. And then actually, so these are some fallacies. So it doesn't mean that they will grow out at their baby. In fact, 2 years old, that's a cut-off. So pag mag 2 years old, kung ano itong era, what is their nutritional assessment, more likely that they will have that nutritional assessment natin. At that's why, pag 2 years old, kung medyo overweight, obese, so we start with our dietary guidance. So if milk, we have to use low fat or skimmed milk rather than the regular milk or because whatever their nutritional assessment, of course, kung saring pa kanina, if underweight or stunted, so there will be a problem. So the cutoff is 2 years old. So doesn't mean that bigger is better. Remember the analysis between a breastfed and a bottle-fed. Though bottle-fed is but it's more of fat rather than the lean meat. or breastfed. Okay, so underweight. So I think it's 6 p.m. Huh? So we're actually just using the ano. So there are ano to obesity, may mga problem talaga. Anyway, damot ton mga kuan, damot mga sinisiring facts. So sige, just a brief kuan. Sige, 6 p.m. actually we also have ano a healing rosary. So I just would like to emphasize it that you make fruits easy to grab and eat instead of the chicheria. Huh? So even for you, for you while you're studying, make this available instead of chicheria, or maybe you can use nuts. And then also your your refrigerator. So whereas ini damo kung ano-ano dida mga gatas-gatas, so make it healthy. So instead of milk, maybe you can have this add fruits. Sige. So you remake the refrigerator. Sige. So I will meet you next week. So I hope 2 days before, so maybe Saturday, you can already submit your questions, your presentation. But between now and you try to have questions, then coordinate with me. So you have the chapters and all. Sige. So what I've given you are more mga practical tips lang. So but still, kasi board exam would come from your Nelsons and your fundamentals. The basic. Sige. Can we pray? We'll lead the prayer. Anybody? So you always assign para diri kuan. You read the Angelos. Inot maara mag-Angelos. Uy, maray maara ba iyo mag-Angelos? Iyan, we'll lead the prayer.
Ako na la, Doc. In the name of the Father, of the Son, of the Holy Spirit. Amen. Amen. Dear God, thank you for the lesson today. It's great to find out new things about your world. It's fun trying new skills and learning to read and comprehend things. Help us remember all we have learned today in class. We look forward to tomorrow and all the wonderful things we will taught. Amen. In the name of the Father, of the Son, of the Holy Spirit. Amen.
Sige. Thank you.